patient, I've been diagnosed with fibroids, what happens next?
So I think once you've been diagnosed with fibroids, the most important thing is determine the level, how severe your symptoms are. And remember, what we're treating here has to do with a woman's quality of life. So not everybody who has heavy bleeding, not everyone with anemia, not everyone with heavy urinating symptoms needs to be treated the same way. So when a woman is at a point where she feels that it's time to do something, time to get involved, then there are a number of different treatment options that can be offered, some invasive and some non-invasive. So Adam, why don't you start us off on some of those?
Well, thank you, Jim. So a lot of the patients, as Jim said, you get treated when you really decide, unless you're one of those patients who it becomes medically necessary. And we always start off with the least invasive, and that can include oral contraceptives, anti-inflammatories, iron supplements for patients who are borderline anemic, not needing transfusions.
Sure.
Hormonal therapy may be used to shrink the fibroids, hormones such as Lupron, which is really long-acting. We really don't love that because it sort of hides the problem, and when you stop it, it gets worse.
Okay.
There's also an IUD, an intrauterine device, which has been used as a contraceptive, but it's progesterone implanted, which causes thinning of the endometrium. And so this is a implantable device that lasts 3 to 5 years that can really help out in the right patient. The really interesting thing about fibroids is based upon the patient, their symptoms, and their anatomy, not one treatment is best for any specific patient. So it really, and that's where we're really special at treating this, is we look at the patient as a whole and really individualize the potential options and the treatment courses that they can then choose which they would like to do.